Hi, my name is Jessica Geiser. This is Social Work 684, Medical Social Work, and my population that I have chosen to work with is children and adolescents with medical conditions. Working with this population does differ greatly from working with adults with medical conditions. In this presentation, I'll discuss how working with child and adolescents do differ from working with adults, the specific challenges that are faced when working with this population, how the social worker will address the challenges that this population faces, families, and some of the challenges a social worker faces when working with this population. I will also review some resources that the social worker will use to help the family and the client, as well as resources that the clients and the families can benefit from on their own. And then finally, I'll discuss the roles that the social worker takes on to help the client and family and how they differ from the medical staff. Working with children and adolescents in the medical challenges and their families brings different challenges than working with adults. Some illnesses include premature birth, an injury at birth can also happen, or some sort of congenital disease. Some of the clients are born with physical limitations or conditions that they will have for the rest of their lives. Social workers do empathize with the child so that they can achieve their goals. Medical staff and parents work together if the child is too young to understand their diagnosis. There are school issues that do occur, absences for one, for doctor's appointments, chronic absences due to illnesses. It can cause lower grades or failing grades and a lack of social interaction. If the absences are expected to continue, there are legal consequences to the family unless a plan is implemented to continue school virtually or at home. A social worker will approach each case differently. Children may not fully understand their diagnosis or treatment. Younger children will rely on their parents to make the decisions, where older children can be involved in the decision-making process. In these cases, an older child would need to understand their diagnosis and treatment options. It would need to be explained to them down on their level so that they understand what they're agreeing to and the possible side effects. Diagnosing a child or adolescent has some specific challenges to doctors. It can also be difficult for parents to determine symptoms that a child is expressing. As a parent, I often hear, "My belly hurts," and I often think, is he really sick? Is he avoiding something? Is he anxious or nervous? Or is he expressing a serious illness? Children don't always say exactly what is bothering them or hurting them. With that in mind, it can be hard to determine if the symptoms the child is reporting are serious. This can cause parents to either under or overreact. Doctors run tests to rule out certain illnesses, as opposed to discussing symptoms with adults that may have explained a symptom maybe a little bit better to the doctor. As with adults, any diagnosis changes the lives of the family. But with a child being diagnosed, there may be siblings that begin to feel left out or that they do not feel as though they are getting enough attention. Social worker will work with the whole family to help with that new dynamic. The social worker must also avoid vicarious traumatization. The social worker faces challenges when working with children. This is when the social worker becomes traumatized in addition with the family, along with the family and the child due to their experiences. And to avoid this, social workers can rely on setting up boundaries between their home life and work life, talking with their supervisors about the trauma, and practicing a nice range of self-care. Some resources that the social worker would need to be aware of would be the Rehabilitation Act of 1973, which is also referred to in the school system as Section 504, the civil rights law that provides accommodations based on the child's disability and resulting weaknesses, but does not require academic improvements. Individuals with Disabilities Education Act, also known as IDEA, is an educational benefit law that guarantees a free and appropriate education to all students. The American with Disabilities Act of 1990 prohibits discrimination against people with disabilities. The Family Education and Privacy Act, also known as FERPA, ensures the confidentiality of the student's written record, making it available only to those with legitimate concerns and only with the student's expressed permission. Resources that families can use, having access to that social worker, definitely helps the family be able to navigate throughout the medical world, as well as acting as a go-between between other providers. The social worker maintains a relationship with the patient and the family to ensure they understand instructions for medications, diet, and follow-up visits. Support groups can also be beneficial. Some specific for children, especially adolescents, can also be helpful, so they can express their feelings to others that may be dealing with the same or similar issues. Internet contacts or support groups for families can be helpful, especially now that we aren't able to meet in person as much. And it is also very helpful if the group is moderated by a social worker. Certain roles of the social worker do differ greatly from those of the medical staff. The social worker does coordinate with the family and available resources that may assist the family in any way possible, not just with the medical necessities, but with the aspects of home life. The social worker will also review what to inform the school regarding the child's diagnosis. The social worker, parents, student, and nurse can collaborate on care while protecting the privacy of the child's medical information. A serious illness can cause the child or adolescent to feel helpless or vulnerable. Social workers can help young patients and their families cope with these psychological and psychosocial stressors that accompany illnesses. It is important for the child and adolescent to not identify themselves primarily in terms of their diagnosis, and educating the child about their diagnosis and treatment and side effects of the treatment and possible hospitalizations can help them not identify as the illness itself. It is also possible for parents to suffer a role change as the person in control, as it becomes the medical staff that become more in charge, especially if the child is hospitalized. This can also magnify the child's fear. Social work often includes different types of therapies for the family, including the patient's siblings, who may also feel overlooked because of the focus on the patient. These are the references that I used for this project. Thank you.